welcome back to Academy Animal Hospital. I'm Dr. Michelle Cahill. So if you've noticed on Facebook, I've been posting pictures of elderly dogs and cats just so you all can see kind of some of those faces of our senior citizens, the four-legged senior citizens. So in light of that, I wanted to talk about canine arthritis, the signs and symptoms, and some of the things that we can do about treating and preventing arthritis. And some of the symptoms for our older dogs is when they first get up, they may just kind of act stiff, and it just once they get sort of warmed up and out of it, they start moving better. Sometimes with the smaller dogs, they may cry or whimper when we pick them up, or they start to hesitate before they jump up, like on the bed or the couch, or they may just stop jumping up on those things altogether. Some of the other symptoms with the older dogs is they play, but they don't play as much or as hard, and then they just kind of collapse when they go to sit back down. Or also, they may also take the stairs a lot slower than they used to. And most of these symptoms are very slow to develop. I mean, it's not something you'll just suddenly see overnight. And you just may think, they're getting older, you know, they're slowing down. And to some extent that may be true, but a lot of these dogs are having some arthritis pain. And the pain of arthritis is very insidious. You know, it's not like this sharp stabbing pain where they're going to cry out in any way. They just won't do as much. Or they may become grumpy with either you, the owner, or with some of the other dogs in your household where they haven't been grumpy before. So those are some of the questions I may ask you about. You know, are you seeing any signs or symptoms when you come in with your elderly pet for their annual or semi-annual exam? So what do we do about it? You know, how do we treat this? And ideally what I like to do is actually try to prevent arthritis before it even starts happening with some of the joint supplements. And many of you already know I'm a big believer in joint supplements, either the glucosamine and chondroitin or fatty acid supplements, as your fatty acids are natural anti-inflammatories for the body. And glucosamine, chondroitin, what that does is it increases the joint fluid, which is the natural lubricant of the joint. And it helps protect the cartilage that they still have in their joints. Now, for some elderly dogs, that can really help prevent arthritis for some time. But there will come a point where your dog is in pain daily from arthritis. And at that point, that's when we turn to what we call our non-steroidal anti-inflammatory drugs for pain and inflammation. And they do seem to work the best. They do, like all medications, they can have some side effects. So what we do there is watch them very closely for the first week or two that they're on them, or even longer, depending on the dog. And then we check just some screening blood work every 6 months to check their liver and kidney function and just making sure we're not having any issues there. And as far as the glucosamine supplements and fatty acid supplements, there's a couple different ways we can do it. For dogs, some dogs that like treats, we have them in the form of treats where they just think they're getting an extra treat every day. And for some owners, it's more convenient to get joint foods with the joint supplements and the extra omegas in them already. And there's a couple different brands of that. So again, these are all different things we can do just to help our canine senior citizens feel better in their golden years, because they've given us the best years of their life, and they deserve that extra care towards the end of theirs. So thanks for joining us here at Academy Animal Hospital, and we'll see you back next week.